today's topic is that is nephrotic syndrome. So as we all know, syndrome that means a group of a disorder which include proteinuria, and it is related with a nephrotic syndrome. That means it is related with a kidney problem. So definition of a nephrotic syndrome: it is a syndrome characterized by a massive proteinuria. Proteinuria stands for loss of a protein in urine, which leads to hypo hypoproteinemia and hypoalbuminemia. Because of that, albumin level will be also decreased, and hyperlipidemia. So there will be a hypoproteinemia in blood. There will be a loss of protein in blood, and hyper proteinuria. That means urine will be lost from the urine, and hyperlipidemia. That means lipid level will be increased. Cholesterol, triglyceride level will be increased in a blood, and pitting edema. So there will be a pitting edema also. Those person who are infected with a not infected, but those people who are having nephrotic syndrome. So these are some characteristics which are seen in nephrotic syndrome patient. Hypoproteinemia, that means protein will be lost. There will be a decreased amount of a protein in blood, and increase amount of not increase amount but it's a massive loss of a protein by the urine, and hypoalbuminemia. That means albumin level will be also decreased, and hyperlipidemia. That means cholesterol level, triglyceride level, HDL and LDL level will be increased, and pitting edema will be there. So edema, as you all know, that is a collection of a fluid in a particular area. So there will be a edema, or it can be like localized edema or a generalized edema. Next is that is the incidence rate. Incidence rate of a nephrotic syndrome. So nephrotic syndrome is 15 times more common in children than the adults. So it is commonly present in babies. Children are more affected than the adult ones. Most cases of a primary nephrotic syndrome are in children. Instead, nephrotic criteria, if we see, like what will be the amount of a loss and increase. So there will, as I said, as we have discussed in definition, that there will be a proteinuria. That means protein will be lost from the urine. So there will be a massive proteinuria. So it will be proteinuria will be more than greater than 3.5 mm of 3.5 gram per 1.7 meter square for 24 hours. So there will be a massive protein loss from the urine. And next we have discussed that is a hypoproteinemia. That means there will be a deficiency of protein in blood. So and it will be, so total plasma protein will be less than 5.5 gram per dl, and serum albumin will be less than 2.5 or 2.5 gram per deciliter. So there will be hypoproteinemia. Hyperlipidemia, that means there will be increased level of lipids in body or in a blood. So serum cholesterol level will be greater than 5.7 mm of oil per liter, and edema will be there. Edema, as you all know, there will be especially in the lower extremities. There will not only lower but in both extremities there will be a edema, as well as person might have facial puffiness also. So mainly there will be a pitting edema in a different degree. This is just a pathophysiology of a nephrotic syndrome, how it can be progressed. Like as we have discussed in previous lectures also, there are so many reasons that can damage the kidney. So according to that etiological factor, GFR will be decreased, glomerular filtration rate will be decreased because of glomerular damage. And the damage can be related with any kind of cause, as we have already discussed that causes. So glomerular damage because of an etiological factor that will lead to increased permeability to proteins to protein area. That means as permeability will be increased, that proteins are more capable to get into the urine, and that will be lost from the urine. So there will be a proteinuria to increase permeability to proteins to proteinuria. So there will be a massive loss of a protein by the urine, which will be like greater than or equal to 3.5 or 3.5 gram per 24 hours. And because of that, it will lead to the hypoproteinemia. Because as we have discussed in previous slide, that is, there is a uh, loss of a protein. So in blood also, blood protein plasma will be decreased. So hypoproteinemia will be there. There will be loss of a protein in the blood. So it will lead to decreased plasma oncotic pressure. So, and because of that, oncotic pressure is decreased, that will lead to the formation of a edema. So because of that, only edema is forming, and also that will lead to the compensatory synthesis of a protein by the liver. So liver will synthesize more proteins, and that will lead to hyperlipidemia. And because of that, cholesterol level will be increased, triglyceride level will be increased, and that will and all these things combined can lead to nephrotic syndrome. So again, I'm explaining this. There will be a first glomerular damage because of any kind of physiological factor, as we have discussed the previous lecture, and that will lead to an increased permeability of a protein, so that that protein will be lost from the urine. So there will be a proteinuria, and it will be like a 3.5 greater than or equal to 3.5 gram per 24 hours, and that will lead to hypoproteinemia, and that will lead to decreased plasma oncotic pressure, as well as the liver will be more synthesized that proteins, and that will lead to hyperlipidemia. So these both are the main clinical manifestation of a nephrotic syndrome in a patient. Like there will be a proteinuria, edema, hyperlipidemia. So, and ultimately this will lead to a nephrotic syndrome. Clinical manifestation, and as we have discussed, there will be a edema or a facial puffiness in a patient with a nephrotic syndrome. As you can see in this picture, this baby is having nephrotic syndrome, and we can see that this person is having facial puffiness or a facial edema because of the nephrotic syndrome. The main manifestation, which will be edema, varying degrees in the common symptom. Like there will be local edema. Local edema mainly it will include edema in face, which we can say facial puffiness, as well as there will patient skin will be like it will be in a pink color around the. So there will be a edema in face around the eyes. That means periorbital swelling. Periorbital, that means near to the eye there will be a swelling. So as we can see in this picture also, this is a periorbital swelling in a lower extremities as well as upper extremities. Next is that is a non-specific symptom, that are the fatigue and lethargy. There will be extreme fatigue and lethargy, loss of appetite, nausea, vomiting, abdominal pain, and diarrhea will be there. Body weight increase because of fluid retention. Uh, as we know that a person with having a nephrotic syndrome, they can't pass the urine. So there will be a fluid overload in a person's body, and because of that, and as well as edema is also forming in the body of a nephrotic syndrome patient. So there will be a body weight gain, urine output will be decreased. That means oliguria will be there, and pleural effusion. So, and because of that, person might have respiratory distress also. Person might have breathing difficulties or labored breathing if this nephrotic syndrome is not in a control. This is just a picture of a nephrotic syndrome baby. So, as we have discussed, its sign and symptoms, there will be a swollen face, swollen limbs, distended abdomen. Abdominal distension will be also there because of the fluid retention. Uh, and swollen upper limb, lower limb, facial puffiness will be there. And as I said, person's skin will look like a pink, it will look in a pink color. Investigation, next is the investigation, like how we can identify that person is having a nephrotic syndrome or not. So first and foremost will be the history collection and physical examination. In history collection, we can collect the history regarding their family history, and we can ask the mother also, like if they had underwent any previous any medical treatment or a surgical treatment or any trauma while the antenatal period. So we need to collect the history regarding that, and we can perform uh, physical assessment. In that, head-to-toe assessment will be there, and rest will be like blood investigation can be done, imaging studies can be done, so that we can come to know about the actual condition of the patient. So first is that is, and as we have discussed in this, like person is having proteinuria, hypoalbuminemia, so we need to collect those readings also, so that we can come to know about the person's status, like in which stage that person is. So first will be a urine analysis. Urine analysis for the collection, urine collection for the protein loss. So we need to know about that how much protein is losing from the from person's body by the urine. So urine collection for the protein, there will be a proteinuria. So it should be like if it is greater than 3 gram per dl, so it is indicative for a nephrotic syndrome. Next investigation is that is a blood. In that also we will check for the protein, serum protein we will check. So there will be a, if there is a decrease in serum protein level, so it is also indicative that person might have nephrotic syndrome. So serum protein decrease, it will be less than 5.5 grams per dl. Uh, gram per dl, albumin levels are low, and there will be a hypoalbuminemia. So albumin levels are low, that will be like less than 2.5 gram per dl. Serum cholesterol level and triglyceride level will be high because person is having hypercholesterolemia. That means there will be a hyperlipidemia, we can say. So because of that hyperlipidemia, person's cholesterol, blood cholesterol level will be increased. Blood cholesterol level as well as triglyceride level will be also increased. So it is indicative that cholesterol level will be like greater than 5.7 mmol per liter, or we can say 220 mg per dl, greater than 220 mg per dl will be there. Other investigation will include, we can go for the renal function test, or else kidney function test we can go. So we can know about the kidney condition, how like we can know about the GFR rate and other function of the kidney. Next is that is a kidney biopsy. We can go for the kidney biopsy also. In that also, as you all know, what is biopsy? That in that a small sample of a kidney will be collected through the biopsy procedure, and that will be investigated under the microscope, so that we can know about the actual condition, and that will be considered in like how we can, in which condition we can perform this kidney biopsy. So if person is having secondary nephrotic syndrome, frequent relapsing nephrotic syndrome, or steroid resistant nephrotic syndrome, hematuria, if person is having hematuria, or a hypertension, in that case we can consider this kidney biopsy. We can go for this, or a low, or if patient is having low GFR rate, glomerular filtration rate, so we can go for this kidney biopsy. Complication of a nephrotic syndrome, that is include, like if we do not control the condition of a patient, so it can further damage to the person body, like infection will be there. Infection is a major complication. Nephrotic patients are liable to infection, because why they are more prone to get infection, because a loss of immunoglobulin in a urine, there will be a massive loss of immunoglobulins, and which helps to strengthen the immunity of a person. And if a person is having nephrotic syndrome, the immunoglobulins are also lost from the urine. So because of that, they are having poor immune system. So they are more prone to get infection. B, the edema fluid act as a culture medium, and this uh, edema is there to the person, and because of that edema, it will act like a culture medium. So any microorganism can easily infect the person, and because of that we are giving them immunosuppressant agent, so that we can control the inflammatory process. And because of that, uh, because of this immunosuppressive agents, person immunity will be low. So Because of all these three reasons, person is having more person is more prone to get any kind of infection. Other complications include hypercoagulability. That means there is a chance of a thrombosis, formation of a thrombus in a blood because of hypercoagulability. So hypercoagulability of a blood leading to the venous or arterial thrombosis because of any clot formation. Hypercoagulability in nephrotic syndrome caused by a higher concentration of coagulatory factors 1, 2, 5, 7, 8, and 10 and a fibrinogen. Because of a higher concentration of this coagulatory factor, there will be a thick blood, and because of that, formation of a thrombus is a high, and because of that, person might get a thrombosis. Lower level of anticoagulate substance like antithrombin 3, and person might have lower level of anticoagulatory substance in their blood. So even that can also lead to hypercoagulability. Decreased fibrinolysis. Fibrinolysis, that means breakdown of a fibrin will be decreased. It will be reduced. So because of that also hypercoagulability will be there. Higher blood viscosity or density will be increased because of these coagulatory factors, and that will lead to a hypercoagulability. Increased platelet aggregation, and because of the platelet increase number of platelet will be also increased, and because of that also it can lead to hypercoagulability, and that can lead to a thrombosis, formation of a thrombus in a blood. Next is that is a ARF. In that also pre-renal and a renal state. ARF include acute renal failure. It can lead in complication. It can lead to a ARF or a CRF, acute renal failure or a chronic renal failure. Cardiovascular disease, in that also hyperlipidemia, as we know that person is having hyperlipidemia, so it can lead to a cardiac disorder like hyperlipidemia may be a risk factor for a cardiovascular disease. Management of a nephrotic syndrome, so it includes general management as well as corticosteroid therapy. In general management, there will be non-specific. Non-specific include like a person will be given treatment according to its sign and symptom. So general therapy includes hospitalization for an initial workup and evaluation of a treatment. So we need to go for a like we need to advise a patient to stay in a hospital just to get the right treatment. Activity includes usually no restriction except the massive edema, heavy hypertension, and infection. We need to mobilize the patient that person can move, and we can guide them for a range of motion exercise also. So we need to encourage the patient to do a light exercise, and if there is any cardiovascular disorder, like person is having any hypertension or any other infection, then we need to restrict the patient for this activity. Diet management includes hypertension and edema. In that, low salt and low sodium diet will be given to the patient, and severe edema. If there is a severe edema, restricting fluid intake. So there will be no fluid intake by the patient, no from the IV or no from the oral also. So nil by mouth and nil for IV, nil by IV also. Protein intake of a person will be there 1 to 1.5 gram per kg per day. So likewise, we need to manage the diet of a person. Avoiding infection, for that we need to maintain a aseptic techniques while we are performing any kind of invasive procedure. Not only invasive, but whatever procedure we are performing on the patient, we need to maintain a aseptic techniques. Diuresis, for that person will be given furosemide, that is a Lasix medication will be given to the person just to increase the urine output. Uh, just to increase the urine output as well as to maintain a blood pressure, and just to uh, manage the edema. Just furosemide will be, Lasix will be given to the person. Corticosteroid therapy will be given to the person just to reduce the inflammation, prevent the thrombosis, and to prevent the thrombosis, as we have discussed, like person as a complication there will be a thrombosis. So just to prevent the thrombosis, anticoagulant drugs can be given to the person. Anticoagulant, that means that the drugs will act they will reduce the hypercoagulability of a blood, that there will be no any thrombus formation. So just to prevent this thrombosis, formation of a thrombosis, anticoagulant medication will be given to the person. So here we are done with a nephrotic syndrome.